Good morning, all of you. I am Sonam, Assistant Professor from Nursing Department in RPIIT Technical and Medical Campus. In a first slide, today I am presenting the topic Vascular mole. In a first slide, there is a diagram which consists two fallopian tube, two ovary, a uterus, and in a below a vagina. And we can see that there are some fruit-like bunches in the uterus that is indicated for the molar pregnancy. Next, introductions of molar pregnancy. It is a rare mass growth that form inside the womb. Womb means uterus at the beginning of a pregnancy. It is also known as molar pregnancy and vascular mole. In our next slide, there are two diagrams. First diagram is indicated for normal uterus and the second diagram is a molar pregnancy because there are some grapes-like bunches in the uterus that is indicated in a gray colors and indicated for the molar pregnancy. Next is definition. It is abnormal condition of placenta where there are partially degenerative and proliferative changes in the chorionic villi and the result in the formation of cluster of small cysts of varying size and the clusters is like bunch of grapes is known as molar pregnancy. In a next diagram, there are two placenta. First placenta indicated for hydrated form mole and second placenta indicated normal placenta. We can see that in hydrated form mole, the placenta is like some bunches which are like in greenish colors and see like grape. Types. There are two types of hydrated form mole pregnancy. First, complete hydrated form mole pregnancy and second is incomplete or partial hydrated form mole pregnancy. Incomplete hydrated form mole pregnancy. It is the placental tissue is abnormal swollen and appear to form fluid-filled cyst and there also no formation of fetal tissue. In that, fetal absent and uterine size more than the date. And in partial or incomplete hydrated form mole may be normal placental tissue along with abnormally forming placental tissue. But there also be formation of a fetus, but the fetus is not able to survive. Fetus is present also but not able to survive in that stage and uterine size less than the date because the fetus is dead now. Next is etiology. The etiology is like maternal age and previous molar pregnancy, nutrition and cytogenic abnormality. Next is sign and symptoms include like dark brown to bright red vaginal bleeding during first trimester. Sometimes glacious fluid also present due to rupture cyst, severe nausea and vomiting. Sometimes vaginal passage of grape-like cyst, pelvis pressure or pain. Other signs like rapid uterine growth, preeclampsia and anemia. Next is diagnostic test. History collection and physical examinations, CBC complete blood count, ABO and RH grouping, sonography, X-ray, histological examinations. We collect the histories about the mother past. Urine test for HCG value increase more than 1 lakh milliunit. CT scan and MRI not recommended. Next is management. We provide first sportive management to the patient. In that sportive management, we firstly start IV infusions, blood transfusions because there is anemia due to over blood discharge through vagina. Antibiotics is given to prevent the infection. Blood is kept reserved for any emergencies. Next is definitive management. In definitive management, first we do the suction evacuations. It is the safe, rapid and effective in almost all cases. And it's done even when the uterus is of 28th week gestation. It is depend on two. First, cervix favorable or group A. Next, cervix is unfavorable. If cervix is favorable, then we perform a speculum is placed in the vagina and a teniculum is clamped to the lip of the cervix and a cannula is inserted into the vagina. And second is B. In a B group, the amniotic fluid, placenta and fetus are suctioned through the cannula into a collected jar. The fetus and placenta are formed apart in the process. Next, management. If both management are failed, then we perform hysterectomy, and if the mother family is complete and any sign of maternal risk, then we perform the hysterectomy. Second, curettage following vaginal evacuation. Follow up. After the discharge from hospitals, we provide some educations to the mother like come for follow up. For what? For inquiry about relevant symptoms, abdominal vaginal examinations, for further investigations and contraceptive advice we also provide to the mothers. Complications which are arise, first hemorrhage, sepsis, perforate uterus and preeclampsia. In preeclampsia is what? Preeclampsia is that in which the BP of the mother above 140 by 90 mmHg. Next is nursing management and nursing diagnosis. First, deficit fluid volume related heavy vaginal bleeding secondary to molar pregnancy as evidenced by patient weakness and decreased urinary output. Risks for injury related to depression as evidenced by patient Comish scale. Next is acute pain related to hydrated foam mole as evidenced by pain score out of 10 of 10, verbalizations of pelvis pain and restlessness. Next is risk of infection related to cluster of small cysts in uterus. Thank you.